Hello friends, welcome to a new question. 25-year-old man is a cigarette smoker with chronic cough and frequent severe respiratory tract infections. Microscopic epithelium shows the bronchial epithelium. What cellular change has occurred? See, bronchial epithelium is mainly a pseudostratified ciliated epithelium. Bronchial epithelium is mainly a pseudostratified ciliated epithelium. But here, if you see this part here, you can see the transformation of this pseudostratified epithelium to squamous epithelium is occurring here, right? Now, so is this change reversible? Yes, this change is reversible. So once you remove the injurious factor, then obviously the change is reversible. What additional epithelial change can occur? This metaplasia can transform into dysplasia. This dysplasia can again get transformed into carcinoma. Thank you guys for watching.